views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Your Health Matters, a three-part series dedicated to health equity in and for the Bronx, presented by Montefiore in partnership with BronxNet Community Television. I'm your host, Melissa Ceballero, and I'm the Senior Director of the Office of Community Relations at Montefiore Health System. Montefiore believes in doing more for our health, our communities, and our futures. The goal of this series is to move towards true health equity in the Bronx by establishing greater access to care and amplifying our already existing community-facing efforts. In order to address the real barriers to health equity and seek to enrich lives by promoting greater economic prosperity within our communities. So tonight, we begin our series with a panel of experts that will explore the question, what is health equity? We'll help define what real health equity means and looks like, and discuss some of the ways we are moving towards equity in the Bronx. Join us. This is Your Health Matters.
Welcome to Your Health Matters. I am Javier E. Gómez.
And I'm Daren, Jaime, and today we have a group of experts joining us to have a roundtable discussion about health equity.
What is health equity? What does it mean for us here in the Bronx? These experts are here to help us understand it all.
Well, we want to welcome Dr. Earle Chambers, and Dr. Chambers is the Director of Division of Research and Associate Professor of Family and Social Medicine at the Albert Einstein College of Medicine, as well as the Core Director of Population of Health of Health and Health Systems at the New York Regional Center for Diabetes Translation Research at Montefiore Health System.
Dr. Kevin Fiori is the Assistant Professor of Pediatrics, Division of Academic General Pediatrics, and Assistant Professor of Family and Social Medicine, Division of Research at the Albert Einstein College of Medicine, as well as the Director of Social Determinants of Health, Community and Population Health and the Executive Director of the Community Health Systems at Montefiore Health System.
AssemblyMember Karines Reyes is a New York State Assembly member who represents Assembly District 87, as well as a policymaker and a per diem nurse at Montefiore Weiler.
And Dr. Simbo Ige, Assistant Commissioner for the Bureau of Health Equity Capacity Building and the Center for Health Equity and Community Wellness at the City Department of Health and Mental Hygiene.
Well, we want to thank you all for joining us for this very important discussion.
Well, today we have an open forum. That means that even though some questions might be addressed to a specific panelist, all others are free to jump in if they have something to contribute to the conversation. Let's begin with Dr. Chambers. What is health equity and why is it important?
It is everyone having a just opportunity to be as healthy as possible. And to do that, we really need to leverage community resources and assets and remove barriers to people being able to realize their health potential.
Anybody else has an opinion about equity? Can expand on the definition?
Sure. So health equity is also what we do. It is acknowledging that there are factors outside of the person that impacts or prevents them from being healthy. And so the efforts that we put in place to remove those barriers, to improve the factors that contribute to well-being, that is also part of health equity. Removing the barriers and putting structures in place to ensure that every individual, every person in the community has an equal or fair opportunity to attain their best health.
Addressing the part of the question about why is it important, what would happen if we do not have health equity? Go ahead.
I think that if we did not have health equity, And in many aspects, we are striving for that ideal to have more health equity. We see all these disparities amongst communities who may not have either access to health care or are contending with those barriers, extrinsic, intrinsic, that don't allow them to reach their ultimate healthy self. And that's one of those things, things that we're fighting in the Bronx, right? That we would like to see a healthier population and a healthier borough. And that means having these discussions about what are the barriers and how can we achieve those health equity goals.
Something to add to that, I totally agree, but it's also the idea that we have these amazing therapeutics, this amazing way of taking care of people when they're sick. And the idea that some communities don't have the same access to those advances is very wrong. And so we need to consider that and make sure that the wonderful work that's done in a building like here, a lot of basic scientists work in this building, the things that they come up with, the cures they come up with, the new vaccines that they come up, that everybody has an equal access to those benefits.
We talk a lot about health equity. When you talk about health equity, one of those barriers seems to be systemic racism, addressing systemic racism. So talk to us about, Dr. Chambers, why is it important to address systemic racism when it comes particularly to health equity?
Well, structural racism is really the systems, the policies, the norms that place whiteness at the very top of opportunity and prosperity. And so in order for all of us to have an opportunity to reach an equitable pursuit of health, we have to remove those structures that oppress based on racial or other kinds of characteristics of populations. So that's kind of, when you think about removing barriers, structural racism is one of those that it's historical and current in that it perpetuates this hierarchy of wellness or prioritizes some populations over others when it comes to achieving your overall health opportunities.
And I would add that there are organizations like Montefiore who have to make concerted efforts to beat those systemic racism issues that may be permeating through a system and the way they function. But I think there's also the role of government to create the policies and the laws and redistribute resources in a way that realign us differently than we were when we're looking at systemic racism.
And I will add that racism is a way of assigning value and power and resources. And structural racism puts people at different levels in terms of their value. It determines who has access to resources, who has access to the good schools and the good healthcare systems, and who do we prioritize in our design of our healthcare. When we structure interventions and treatments based on a certain group without consideration of others, that is structural racism. When we determine who has access to treatment without considering others, that is structural racism. So it is not just the interpersonal, like, oh, I see you, I don't like how you look. It is that there are systems and institutions and resource distribution systems that put certain people at the bottom. And so they never have access to the same resources and power to stay healthy.
Is this a conversation that we find is becoming more prevalent in the medical community?
Certainly. I can jump in.
Right, jump in. Right.
Right.
I think it has, and I think the dialogue that has started as a result of a lot of unfortunate tragedies that the United States has been dealing with, especially the past 3 years, from George Floyd to Breonna Taylor, has amplified the importance of us in the medical community acknowledging that this exists for our communities that we work with, and that it has to be part of how we take care of patients, that we have to acknowledge that, to Dr. Atkins' point, you know, I'm a pediatrician, so I have to acknowledge that some of my kids are swimming upstream with the current vis-a-vis some of the other families that I know that live, you know, maybe outside this borough. And there are structures in place that are causing that. And so we have to acknowledge that and make accommodations for it.
Yeah. I'll also add that, you know, we tend to think of individual health and target health as just an individual issue to be addressed. And people live within contexts. They live within communities, live within families, they live within larger structures. And so understanding how these different levels influence a person's ability to realize their health potential is important. And so addressing issues around structural racism is also part of that. Having a health equity focus is also part of that. It acknowledges that there are things outside of the individual that influence their ability to be able to adhere to some of the health prescriptions that we're telling them or asking them or you know, coordinating and being able to sort of help them realize. So it requires us to really think more about how all of these systems contribute to an individual's ability to be healthy.
Adding a little bit to the structural racism conversation, you've spoken very good about it in terms of policy, but I was wondering, I was a little bit curious, how does it manifest in people's lives? How can you identify it when you see it or when you experience it?
Well, I'll say that one thing that we've been looking at in terms of policy, and I'm sure that the doctors here would agree, is cultural competency when we're training medical professionals. And we look at that in every aspect, but particularly in the delivery of healthcare. Having individuals that are competent in what some of the cultural aspects of the people that they're representing and understanding some of the challenges that certain communities face every day is paramount in making sure that the communities that they're serving are really meeting the targets and have better outcomes. So in terms of policy, that's something that we've been looking at. How do we include that in the education or mandate that in many ways in the education of our medical professionals? Because it does affect the lives of the communities that we're serving.
I would just add to that as a pediatrician, you know, there's also this element of cultural humility, the idea that I don't understand everything that my families that I get to work with have gone through. And so there's this great phrase, it's called the art of hesitation, that it's coined by the Maui Indians in New Zealand. And they talk about just taking a moment before you address someone, just try to imagine that you don't understand what it's like to walk in their shoes and being open to understanding what it might be like. And so I think that's something that we have to do as providers as well, just to check ourselves. Like, I don't understand everything that's going on with this family, and I need to be open to trying to learn.
And I'll say one last thing. When you say how does this manifest, let's say you have a patient that has diabetes and you have, you know, written a prescription for this patient, but you know that there are some lifestyle modifications that will also help what they eat, for example. And this patient lives in the Bronx. But do you realize that in the Bronx, access to healthy food is harder than living in other boroughs? For example, the ratio of bodegas to supermarkets in the Bronx is much higher than in other places. So that individual has less access to farmers markets, has less access to healthy produce. So if they were to adhere to your recommendations, they will have to work harder to do those things that they require to stay healthy. Structural racism is also manifest in terms of the diversity of the workforce. When there is physician, patient, racial and cultural alignment, there is more trust. But if we look at our healthcare system, for example, if you look at how many black physicians are there in the United States, less than 5%. And there's more than 13% of us in the US that are black. So the educational system, the work environment, the places where people live, the neighborhoods where they have to make decisions to stay healthy, these are all of the manifestations of structural racism. It's all around us.
And I'll just add something that she said about when you have a physician prescribe perhaps a dietary change for somebody who's a diabetic. Understanding not just the fact that there may be barriers to accessing healthy foods where they live, but also cultural barriers to what they eat, right? You can't tell certain people from certain cultures, you know, you should go completely vegetarian, or understanding that in many cultures, rice is the primary source of carbohydrates, and you're asking people to reduce carbohydrate intake, perhaps because they have elevated sugars. And understanding culturally how people eat is just as important as making those prescriptions as doctors.
I want to stay right there. Keep talking to you for a second because in addition to being an assembly person, you're also a nurse. And, we talk about social needs, but why should a doctor talk about social needs, particularly during a visit, right? And the importance of talking about that, because that could be a game changer in many ways, right?
Yeah. And I think we've touched on that in many ways, but every aspect of our lives, where we live, where we work, how we travel, what we eat, all those have an impact on our health. And doctors should know if there are instances or circumstances or aspects of your life that may be affecting your well-being. For example, if you look at the Bronx, we have some of the highest asthma rates. Partially it's because of pollution. Partially is because people's housing they may be struggling with mold or vermin. All of these things that exacerbate asthma, or in many instances may cause the development of asthma in children. The ability to maybe access foods or not. Perhaps these people, the patient that they're seeing may be living in temporary housing, in a shelter, and may not have a facility to prepare meals. All those things impact their well-being. You may have a senior who has a congestive heart failure, and their elevator is broken most of the time, and they may not be able to climb the stairs up to their apartment. All those things impact the health of individuals. So having those conversations with your doctor are important, because they may be able to help or perhaps change what their recommendations are for.
Yeah, and let me follow up and ask the doctors a question, right? How do I go about being able to assist somebody who has these needs? Because for a real practical point of view, I want to do the best I can, but sometimes I'm shortchanged with my resources and what I'm able to do. So as a doctor, what can you do to help to meet these needs?
Yeah, it's a great question. And I think AssemblyMember Reyes really hit the point of it, which is we should know about it first as a physician, because it matters to you and your family. So I should know about that, and your doctor should know about that. I have found that my patients are extremely savvy, and they know that I am not a miracle worker. I am not going to solve their housing problem. I am not going to solve, but I might be able to refer to a team member who has more knowledge in this area that could help them, a social worker, a community health worker. We have both of those at Montefiore within our primary care practices. And so if we're not talking about it, it's very hard to come up with a solution. But if we're talking about it, there's opportunities, and if we know that it affects health outcomes. And so it's important that you talk about that with your doctor.
I have a reaction to what you're saying and Daren's question, and then I'll follow it up with a completely different question. I understand from what I'm hearing you say that there seems to be a mentality shift that needs to happen in terms of the definition of health. It's going beyond symptoms, right? Can you abound a little bit about that before I ask a totally different question?
I think what we're saying is, if we're talking about health and wellness, we need to be talking about the context and the social factors that influence those things. That it's not okay anymore just to talk about clinical care in isolation, because there are too many things that affect one's health not to consider. And I think that change has already started in our community. It's definitely started at this institution, where we need to talk about these other factors, because it will ultimately influence how well we can take care of a patient.
And I think that's also been driving the conversation in terms of mental health and mental wellness, that somebody's perceived stresses or their mental state can also impact their physiological well-being. And that's been part of the broader conversation as well, where it's no longer just the physical health of people, but how their living conditions, their working conditions, the relationships that they're in, all of that can impact their overall health as well.
It helps us to expand the definition of health to really include wellness in a number of different ways. And so having a better idea, and we've talked about this sort of before, about putting the individual, the patient, within their context that they live within, it really forces us to really look at these other kinds of characteristics, some of the social environment that influence their ability to be able to prioritize their health concerns. And, understanding what those concerns are for them. Asking about what those needs are and what kinds of issues are affecting their ability to be able to prioritize health for themselves and for their family, the things that they care about.
And finally, I'll say that, the definition of health has been expanded to mean not just the absence of disease or infirmity, but a state of physical, mental, emotional, social, and even spiritual well-being. So all of those are now formalized into the definition of health. So it is not just the physical health, it is all of those things.
Right.
Well, given that we now have a broader definition of health, effective health services require multiple sectors to work together. And this panel represents various sectors that are essential to accessible, equitable, and affordable healthcare. The following questions can be addressed by anybody in the panel. What role does Montefiore play in addressing health equity?
Maybe I'll start as a Montefiore. Definitely, maybe not the representative for that, but so this is something that we actually have a history of thinking about based on the communities that we get to work with. So one thing we have to think about, and this has been already brought up, is the idea of how do we increase access? How do we make sure that we are in locations that are convenient for communities? How do we make sure when somebody shows up at a clinic that we're accommodating for differences, whether somebody has another preferred language? It also encompasses the idea of what we were just talking about. We ask about social needs during our visits. It's our goal here at Montefiore, for every patient that we ask about social needs at least once a year, because we want to know those needs, because we know that it matters to patients. It matters to our ability to be able to provide excellent care. And then we go about making investments in how we can help families. We have connections with and partnerships with community-based organizations around food insecurity, for example. We have a housing at risk program that focuses on families that are having a hard time finding shelter, making sure that they have what they need. And so it encompasses all those kinds of things, and it's a priority for us here.
And I'll add to that. Montefiore is the largest healthcare provider in the Bronx. So as such, they have a responsibility and a huge weight on their shoulders to uplift the well-being and the health of Bronxites. But one thing that I think Montefiore has been doing very well is in the educational spaces and in health and educational spaces, where they also partner with some schools to provide some of the community-based health clinics within schools as well. And I think identifying areas where they can make impact other than outside of the walls of the hospital is important. And I think that's what Montefiore has been doing, and that illustrates what you just said as well.
That's a great point. So Montefiore has the largest school health program in the United States. And so the idea of bringing services closer to where the patients are. So for kids spend most of their time in school. So it makes sense to put the clinics there.
I want to come back to Karines for a minute and talk to her, because as I gave you in the intro, you're an assembly member, but not only an assembly member, you also work as a nurse. But talk to me from the government perspective, and then I'll let your colleagues chime in. Talk to me from a government perspective about what can government actually do when it comes to the issue of health equity. What can we be expecting from government in order to make this health equity issue much better?
Well, I understand the role of government is to protect the rights of its citizens. and to pass laws and advance laws in the pursuit of such. And like we've illustrated during this conversation, that means equitable education, equitable access to housing, equitable access to healthcare and healthcare resources, job protections. All of those things that government touches upon impact the health and well-being of people. And I think on a more tangible aspect, the role of government is to disperse resources. And we look at communities that are deeply impacted, who may need more support. And part of that is also the changing face of government. Because we've been working to change the face of government so they're more reflective of the communities that they serve and they represent. In the state legislature, we have the largest delegation of people of color from the city of New York that we've ever seen. And that has been felt in, for example, how institutions like Montefiore are funded and the reach of the work that they do based on those resources.
Others want to chime in about government?
Well, I work in government, so
What you mean, government? Right, okay.
I'll say a little. One of the areas where government has been working on is in the area of accountability. First, acknowledging that we haven't done enough to assure equitable access to resources so everyone has a fair opportunity and a just opportunity to stay healthy. And in acknowledging that, ensuring that we have put measures in place to have very clearly defined objectives and goals for health equity and working towards those goals. So at the New York City Department of Health, for instance, we now have a chief equity officer. And in September 2021, the Board of Health had a resolution declaring racism as a public health crisis. That when you drill down behind all the social determinants of health and who has access to resources is structural racism. And that really racism is what is the root cause of the health inequities that we see. And it's not just naming that, it's now putting very measurable, tangible goals for what we want to see happen going forward. And some of the things that we have done include, we have even changed our language. When you say marginalized communities or marginalized neighborhood, now we say priority neighborhoods and priority communities. So identifying neighborhoods that have been disinvested and marginalized. And the city has set up a task force for racial inclusion and equity where we now have to report on what we are doing to support those neighborhoods. They have now become priority. And ensuring that health outcomes are tracked and disaggregated in a way that can help us see who's been left behind. Because when we say the health of Asians, there are so many nationalities, within that one term. How are we ensuring that no one is left behind in our reports and in our data and who gets represented? So those are some things that we're doing, and then putting programs in place. We now have a public health core initiative that has over 1,000 community health workers working to ensure equity with COVID recovery. And now we can say in the 3 neighborhoods, we are now at par with the rest of the city in terms of vaccination coverage. And where we can say, folks that are Latino New Yorkers and folks that are Black New Yorkers now have the same vaccine coverage as the rest of the city. So those are some tangible ways to ensure that we're walking the talk and that we're holding ourselves accountable for ensuring that all New Yorkers have the resources that they need to stay healthy.
Dr. Ige has given us a pretty good x-ray of what departments of health can do to help with health equity. But does anybody else on the panel have any ideas, looking from afar, about what can be the role of health departments in ensuring health equity?
I think health departments they're in a unique position in a way that no other entity is. That definitely a health system maybe not, in that they are responsible for an entire population. Where, as Assemblyman Reyes said, Montefiore is the largest healthcare provider in the Bronx, but we're not taking care of every patient in the Bronx. We would like to, but and so health departments are uniquely positioned to be able to really address some of these big problems. And as community members, government is us. And so we can vote and we can ask that our representatives and our public health officials that this is on their radar and that they're addressing this because it's important to us.
Yeah, I'll just add, I think we really think about, what we talked about, patterns and how health departments can be sort of catalysts to help us align our overall goals for wellness and health as everyone who's interested in this as a population. We're all better for it if we can get sort of those of us who have less access to have more access. So what I'll say about it is in thinking about how to align our priorities in ways that can help us advance sort of our health equity mission, I think is a way that we should be starting to think about and aligning with all of the different sort of providers of health in the Bronx, Department of Health included, but also these health systems.
I'll just add, I think our health department is the hub that collects all the data that informs every health initiative, whether it be policy, whether it be the initiatives of individual medical centers. But a lot of that is work that is based on the aggregate data and the disaggregate data that a health department puts together. And I think that is a very, very important overarching role of the Department of Health.
Let me ask a question. If you think about the word health equity and you look within your own particular context, when we talk about progress, what would you identify as a measurable outcome that the public can say, oh, that's a sign that we're starting to see health equity, or health equity is being demonstrated in your capacity?
I'll just add,
I'll go across. How about that? I'll make it easy. Everybody got time. So
yeah, going. I'm gonna follow from what we were talking about before to kind of make this point again, which I think we've talked about already. Is it relates to the research. So I do a lot of research sort of in areas around health and health equity. So thinking about how we can disaggregate and identify the intersecting identities of our population. We have a very diverse population, so we have the ability to really look at how different identities intersect and then where there are pockets of risk and where there's pockets of resilience. I think it's important for us to think about all of the assets that our communities have as well. And so it's not just about sort of identifying poor health necessarily, but it's also identifying resources that we can help leverage to make populations even healthier. So when I think about intersecting identities, I'm talking about, you can think about race, you can think about ethnicity, you can think about gender identity and how they intersect with one another. So those are some of the strengths of our ability in the populations that we serve, because we're so diverse. We have a lot to say about how we can really leverage that and be able to really disaggregate, like was being said before, the data to look at populations in their full sort of complexity, and then it really just it validates sort of that our different populations are being seen. We identify that these you might have certain challenges that we need to recognize. And so being able to leverage the information and the data to be able to answer those questions, I think, is important as well.
AssemblyMember Reyes mentioned the importance of the Department of Health to gather data as the foundation that informs kind of everything. In terms of statistics, what are we working with now in the Bronx? What are the numbers saying, if we know?
Yes. Unfortunately, when we look at the statistics for the Bronx right now, the Bronx is still in the bottom 25% of New York City and New York State even in terms of health outcomes. And that is something that we are working very hard to change. When you said, what does health equity look like? Health equity looks like not having someone born in Manhattan live 11 years longer than someone born in the Bronx. That if you happen to be born in the wrong part of town, your risk of dying early is that much higher. And those are the things we don't want to see in New York City. This is one of the richest cities in the world. That should not be the case. It's not fair. That is a social justice issue, because the resources we need to stay healthy are available. We just need to redistribute them. So those are some of the things that we're working towards. If you look at the COVID-related data, those who identify as Latino had the highest rate of mortality from COVID. Now, this is an infectious disease that anyone can catch. But when you look at the data and see that, yes, so many people got sick, but look at who got hospitalized and look at who died from COVID. And what can we do to ensure that those things don't repeat themselves? And what are the drivers of some of these inequities? And I think that COVID has caused an intensive era of reckoning that has mobilized a lot of stakeholders around this issue of health equity. So we have a momentum now to make change happen. And I hope that we can sustain that beyond COVID to see how we can reverse some of these inequities.
I think the undercurrent of all of these inequities, particularly in the Bronx, is poverty, deep poverty. And you know, in the Bronx, we have communities that are also undocumented and poor, right? And in many ways, they live in the shadows. And I think part of the role of government and government agencies like the Department of Health is to pull people out of the shadows so we can better understand what their needs are and how we meet them. And at every turn, try and fight back poverty, right? Because it's not just about their zip code. It's because most people in that zip code are impoverished. And how do we kind of raise the tide for all those people?
Yeah, I'd love to come back to your question about progress, because although we have a lot of work to do, I think we have examples of progress. So on a high level, for example, we have now in the New York City Department of Health and Hygiene, we have a position focused on health equity in Dr. Michelle Morris, who is a wonderful physician. We have leaders in health systems, like our own leader here, Dr. Philip Oswa, who has made it a mission and a priority of this health system to think about how we can do better in this area. We have small victories, like some of the things that I experience with some of the families that I work with. The idea that we can recognize problems around social determinants of health and unmet social needs, and we can do something about it if we ask and if we position ourselves. And so I think, you know, none of us, besides Dr. Chambers and I, we don't work together. We're coming together for the first time. We're talking basically there's not a lot of disagreement in what we're talking about in terms of health equity. And so I think that's a sign of progress. We have a lot more work to do, but I think the importance of it right now is unparalleled and unprecedented.
And Dr. Chambers mentioned something in his previous response, where he talked about that we have pockets of resilience as well. And there are folks in the Bronx, we talk a lot about how poorly our health outcomes are, but we have folks in the Bronx that are very, very healthy. And understanding why that is, right? Whether it be personal health choices, cultural choices, whatever that may be, and understanding the intersectionality of that and how we can amplify that and perhaps replicate it in other parts is important as well. So it's not just us talking about how bad our health is. We have actually some good outcomes too, and you can talk about life expectancy and all those things. Because there are really great stories in the Bronx as well. Sometimes we get a little bogged down about us being the last, but we have some amazing things happening here as well.
Well, a little earlier, I posed a question to all of you, talking about government, right? And what role can government play in health equity? But we're a public television station. We deal with community watches. I want to ask you now a question about community. What can community actually do in assisting in this health equity matter? I'll start with anybody. You can all fill in.
Yes, I can start. I think one of the areas where the community can play a role is in information. Information is power. There are a lot of people out there who are not aware of what resources are available to them and how we can help disseminate this information is really important. When we say we have community health workers, they really are connectors. They help folks know where to go and who they can, reach out to when they need help. Another area that I think is really important right now is the social support. With COVID, it's literally like the fabric of our social life is unraveling, and how that is taking a toll on all the stressors. When we've done surveys, people have said that the part of COVID that was the hardest for them is the lack of social support, not being able to see family, not being able to see friends. And defining health as not just the absence of disease, that social network is important. Even for those who are in treatment, having social support is a predictor of being able to do better with your treatment. Even if you're on treatment for any disease, just having that support can be very powerful. So we can support each other. We can check up on each other. You can pick up your phone and call someone, how are you doing today? Just checking up on you. You know, those things matter. And helping people to know where to go. I have this great doctor, you know, if you need help, I can connect you. You know, I know this great nurse. If you need someone to know, just find out what's wrong with you. Don't just stay at home. This might be something, you know, friends, neighbors, church members, we can help out each other. It's not just the doctors and the nurses.
So I think communities can vote. I think that makes a difference. And if they feel like their representatives are not they're not acting in a way that they feel is in their best interest, then they can get up and advocate. I also want to come back to this idea of taking an assets-based approach, meaning, you know, we tend to always focus on the negative and the deficits, but there are amazing examples of resiliency and progress, and coming together to celebrate those, I think, is really important. And I also think, like, the community did not create this problem of health equity. We've established that these are structural things that were put into place by not the communities that are affected, but the solution will not come without the community. And so the ability for community members to engage in these kinds of initiatives. You talked about community health workers. I couldn't agree more. I mean, I think I am a community health worker Kool-Aid drinker. I've worked with them throughout the world the past 20 years. The things that they bring to health systems and to public health initiatives are amazing, and that's community expertise, and they're part of the solution. And so I would just encourage anyone who wants to get involved in this is, you know, find ways to engage, because I think that is where the solution lies. It's not going to come from, you know, Dr. Chambers and I sitting in our office. It's going to come from, you know, getting to work with community members and figuring out how to do this. Sorry, Dr. Chambers.
It's very important, and one of the biggest issues that we've seen, not just in government, but in all aspects of our lives, is just apathy, where people just don't care or don't care to get involved. And oftentimes, sitting out of an election is more powerful than actually going out to vote, because it helps determine elections. So being engaged in the political and the democratic process, but also getting engaged in all the things that are happening in your community where you can be making an impact. You may think that you're not making an impact, but just participating in the process. It allows folks in your community to see that there are more people involved, and that just draws people in. And we're not going to get to a solution without all of the community getting involved, or most of the community getting involved. So beating apathy is super important.
I'll just add, our collective voice is important. I mean, I think, you know, advocacy is important. Hold these institutions accountable. You know, require more of them. Require that they are responsive to your needs, and you know, come together within the communities or the social groups or the religious groups or the organizations that you're a part of, or the communities you belong to, and really advocate for what it is that you need.
This conversation is the first installment in a series of forums that we will be filming. And I know when it comes to health equity, we're going to be talking about solutions as the series progresses. But can we raise the curtain a little bit about solutions? What should be the next steps as we continue to move and aspire toward health equity?
If we all agree that social determinants of health drive health equity, and we agree that structural racism can impact that in a very negative way, then one solution is addressing structural racism. That who has access to resources, who has access to power, that's one very tangible way of doing that. We also think that another way of doing that is an all-of-government approach. So these social determinants of health that we're talking about, when you talk about housing, when you talk about the quality of education, when you talk about transportation systems even, these are factors that are outside of the Department of Health. That means we require MTA to be part of that conversation and the Department of Education to be part of that conversation. And everybody seeing themselves as a contributor to health is important. Many times when people say health, they think hospital. But this is an all-of-government, all-of-people approach. The factors that determine who's healthy or not is not just healthcare. We need everyone to come together. And we also need to address the educational piece of it. The doctors have talked about an increase in awareness around the role that social determinants of health play, but also in every sector, that folks understand that the food you eat and the places you live in and the information that you have access to, all of these things are important. So I think that the educational piece of it, people's understanding of what determines health is important. So people are not waiting to get sick and then, I'll go get a medication, in terms of how they can stay healthy and how houses can be health promoting. The building, the architecture, all of those things contribute to your health. So that educational piece, I think, is also something we can do to help us move this agenda forward.
So I would say we got to acknowledge it's a problem, which I think we're doing here.
Right.
We need to engage, meaning we need to think about new ways that we do this kind of work. And lastly, transform the systems that we have today for the kind of progress that we want tomorrow. And I think, we cannot accept the status quo. We have to make the way that we deliver care different. We need to acknowledge the kinds of things that create barriers and go about trying to address those.
I think
Next steps?
I think the doctors all have great ideas. I think the government has a role to play here as well in terms of providing the resources to bring a lot of these to fruition. And there are many policies that have been introduced that perhaps are waiting to be passed, and we always ask community members to weigh in on that, whether that be reaching out to their local electeds, getting involved in actions or groups that are pushing some of these measures to kind of change the playing field for many of us and have a deep impact on our overall health. And that may be what, education funding, labor protections, changes in transportation, you name it. But a lot of those things, the conversations have been happening, and there are many people that have very creative ideas on how we make change.
Thank you all for joining us.
Thank you. And to our viewers at home, make sure that you keep the conversation going about Bronx health and also about Bronx health equity.
This has been a panel discussion presented by Montefiore Health System and BronxNet Television. Please remember to join us in the next installments.
I'm Daren Jaime.
And I am Javier Gómez. Always remember, your health matters. Good evening.
Thank you for joining us on the opening panel of Montefiore Your Health Matters in partnership with BronxNet. I hope you learned as much as I did. Thank you to our participating guests for all of your valuable insight and for the important role each of you has in this work. Community, our discussion doesn't end here. This is a 3-part series, so stay tuned for our upcoming workshop on where the Bronx currently stands in health outcomes. followed by a town hall to begin a community dialogue on what we can all do to reach true health equity in our borough. I'm your host, Melissa Ceballero, reminding you that your health matters. See you next time.